Hello, my name is Barbara Del Prince, and I'm the Global Marketing Director for Women's Health Ultrasound at GE, and I'd like to welcome you to today's webinar. Today I'm very proud and excited to be introducing the newest member of the Voluson product family, the Voluson Expert22. This new ultra-premium platform is designed for thought leaders like yourself who push the boundaries in women's health ultrasound every day. To tell you more about the product, we invited a few physicians who helped us develop the Voluson Expert22. I'm pleased to introduce Professor Rabi Chawi and Professor Alfred Abu Hamid, who, along with others, have been critical in working with our engineering and clinical development teams over the past several years.
Thank you, Barbara, for this warm welcome. It is indeed exciting to be introducing a new product, which undoubtedly will greatly impact imaging in obstetrics and gynecology. Hello, everyone. I'm excited to be here along with Professor Rabi Chawi to co-chair this presentation and to introduce you this brand new product, the new Voluson Expert22. It took several years to perfect, and we are hoping to show you in this short video how impactful the new system is. Dr. Chawi?
Thank you, Alfred. Today we'll be joined by other leading physicians in fetal imaging to share some of their experiences of using this machine. We have been working with the system for about 18 months. And as we hope you will see during this short presentation, we are really excited about the capabilities and especially the innovation that this high-end ultrasound machine brings. I was asked to reflect my experience, so I was wondering what to answer. On one hand, these are various tools in the system, like you're going to be seeing this meeting today, like the radiant function, now present also on grayscale, giving the 2D image a new dimension in a way, similar to the radiant flow for the color. On the other, there are some interesting new tools on 3D, which I'm sure will be shared later on by Dr. Benoit. But for me, the big leap in the system is based on three things. First, it is a new platform, complete new platform, which brings a good combination of a tablet and the good functions of the E10 with the buttons without the keyboard. So with many tools are now on the touch panel. Second, there is the possibility of customizing and personalizing the system, starting from the colors of the display to the position of the different fields on the panel. So you have the impression you are configuring your own machine like your tablet. And at the end, it's not one Expert22, it is my Expert22, my own one. And the number three is, for me, the ergonomy, which is starting from the scanning, from the response function, where once you hold the transducer, it is automatically activated. In addition, there are some new functions like the flow profiles. It is like a kind of macro. That means where you can rapidly get to an optimized image on color Doppler of the pulmonary veins, for example, or getting rapidly flow profile of the uterine artery with the automation of the measurements directly displayed. So it really increases the velocity of examination. Alfred, what about your impression?
Thank you, Rabia. Let me add to all this, what impressed me the most, beyond the ergonomic design and the ease of use, the system has major leap forward in grayscale and color Doppler resolution, which to me is essential given that we spend more than 90% of our scanning in these domains. I also like that the system is designed with the end user in mind to help improve unit efficiency and reduce time in scanning. This is really very important today, given how busy we are in our ultrasound units. The system has also significant automation and artificial intelligence, from recognition of standard planes, automated measurements with accuracy, and also software to help the user, such as Fetal HS, which is an automated software to help display the cardiac axis and planes required for cardiac screening obtained from a 2D sweep. Indeed, a significant innovation moving forward. Now, we will start by introducing 4 speakers that will share their experience. I'm pleased to introduce the first speaker, Dr. Elena Sinkovskaya, Professor of Obstetrics and Gynecology at Eastern Virginia Medical School, who will discuss the performance of color Doppler and how it aids in speed of diagnosis. Elena?
Dear Dr. Mohammed, dear Dr. Shawi, it's my pleasure to be here, and I would like to thank you for the invitation to speak and share my experience with the new ultrasound system, Voluson Expert22. And indeed, from the first sight, it was the real story of love. And I would like to show and start my presentation from the very first case that I was able to perform on this new system. This patient was referred to our department for dating and viability at 11 weeks and 4 days with a known monochorionic diamniotic twin gestation. And at that day, congenital heart anomaly was suspected on twin B. So here we have the 4-chamber view of the heart on this fetus. As you know, the evaluation of the heart as early as 11 weeks gestation is very challenging. It's even more challenging in settings of the twin gestation, in particular on twin B, which is always more difficult to get. And here you can clearly see how well this machine performed an evaluation of that baby's heart. We can clearly visualize the chest. We can see that there is definitely some abnormality going on with the fetal heart. And on this still image, we can clearly visualize that there is no flow on the left side of the heart, and there is just single inflow on the right that makes this heart suspicious for the univentricular heart. And looking at the 3-vessel and trachea view, we were able to confirm our suspicion. So we can see just one big vessel, and we can't really recognize the other vessel. So all those findings together were able to make the conclusion and diagnosis of the hypoplastic left heart syndrome, very severe congenital heart anomaly. And at that point, we were able to counsel the patient appropriately. I would like to demonstrate that this case, how powerful is this machine, and in particular, the color Doppler techniques that are available on this system, that we can be very confident in the diagnosis as early as 11 weeks gestation. Also, I would like to point out that on this machine, we have all spectrum of the different color Doppler modalities, including conventional color Doppler, HD color Doppler, power Doppler, and slow flow, that in combination with the radiant flow and the volume imaging can really show and present really unlimited possibilities to visualize the blood flow, not just in the heart, but in the rest of the body of the fetus. And here I have few examples how artistic images could get if we are applying those techniques. This is, for example, the 3D image demonstrating the pericallosal artery and the branching of the vessels in the mid-sagittal plane of the head. And here is the very dramatic image showing the vasculature of the fetal liver at 28 weeks gestation, demonstrating the umbilical vein, the portal sinus, the extrahepatic portal vein, and hepatic arteries. So all this is possible using the new modalities and the improved algorithms for the Doppler imaging on the new system, Voluson Expert22. So, but the real revolution, I think, is really applies to an assessment of the spectral Doppler. As we know, the color Doppler and the beautiful images, they're really interesting things to look at. But for the practitioners, for people who are sitting and scanning in the screening settings or in the very busy clinics, those images are probably have less importance than the appropriate measurements and the appropriate quantitative data that can be obtained from using the spectral Doppler imaging. And I think that the new modality and the new option, which is available and presented here as a block on the touch screen here, this is something that will make the significant change in the way how we do Doppler ultrasound, not just of the heart, but of the other vessels in the fetal body. And this is basically shows that the Doppler image optimization, for the most part, includes the adjustment of the following parameters, including scale, wall filter, sweep speed, gain, and baseline. So the flow profiles allow for quick optimization of all those parameters depending on the vessel that we are looking at. And there are 6 options, as you can see here. We may use the flow profiles for assessment of the uterine artery Dopplers, MCA, ductus venosus, umbilical artery, and in the cardiac for pulmonary veins and just the intracardiac flows. So just the push of one button allows automatically to optimize all those parameters and significantly improves not just visualization, but really you have to spend just a split of a second to optimize the image. Here you can see the example, how we can go from this image of the umbilical artery Doppler, which is very routine for obstetrical practice. And the image looks not bad, but you know that the optimization by pushing this umbilical artery optimization button, we can really see that the image can be significantly improved. And you can visualize here that the sweep speed was adjusted, the position of the baseline, and the spectrum looks cleaner. That also has an advantage that involved the automatic measurement of the spectrum and those parameters that we're really interested in. This is the pulsatility index or ASD ratio. And you can see that the automatic trace of the spectrum is very precise. And this is really speeds up and makes the those measurements so fast and really efficient that at the end of the day will improve the productivity of the ultrasound imaging. If you look at the cardiac Doppler imaging, it's well known that it depends, the image optimization depends on what area within the heart we are looking at. And the optimization is quite opposite depending on the which valve we are looking at. So if you're looking at the intracardiac flows, we need to set up our settings for high velocity scale, high wall filter, low gain, and low color persistence. If we are looking for the pulmonary vein blood flow, the optimization should be completely the opposite. It should be low velocity scale, low wall filter, high gain, and the high color persistence. So it's pretty obvious that we need to do some adjustments of those parameters back and forth during the fetal echocardiogram. So the utilization of the flow profiles, we can go back and forth from the intracardiac flow to the pulmonary veins flow in a click of just one button that you can see here. We can switch between the cardiac and the pulmonary veins. And if on the cardiac preset, we kind of see a little bit of the pulmonary veins, they're visualized here. But by clicking on the pulmonary veins, we really can visualize the pulmonary veins on the left and on the right side. This is the inferior pulmonary veins very clearly. And that would ease the not just the direct visualization of those veins, but also the placement of the cursor of the spectral Doppler that allows to look at the shape of the waveform in these vessels. And again, using the flow profiles allow to optimize the spectral Doppler as well. If we are in the cardiac preset, the traditional cardiac preset, usually we will obtain this image first, and then we will need to adjust the scale because the flow in the pulmonary veins is very low velocity. We will need to adjust gain and other parameters. But using the flow profiles, all this is absolutely unnecessary, and even a not very experienced user can obtain the perfect picture like shown here in a split of a second. So I think that this is a great advantage of the new machine, and I highly recommend to everybody to explore the opportunities that this flow profiles can provide. And at the end, I would like to say that the reason why I fell in love with the Voluson Expert 22, that the image quality is absolutely amazing. And overall, the system shows unbelievable intelligence that make my everyday practice more productive and give me more confidence in my diagnosis. Thank you very much for your attention.
Thank you, Elena. This was excellent indeed. So Alfred, tell me, what is your impression, your personal impression on the use of color Doppler from slow flow to radiant flow on this new system?
Yeah, so you could see from the images how exceptional the display of color Doppler is, starting from the first trimester, and using slow flow to highlight really low velocity flow, that substantially aids in diagnosis in the first trimester, whether you're looking at the fetal heart, looking at the fetal brain, looking at the placenta, cord insertion, and so forth, significant impact. Then as you progress into the second and third trimester, you see that the system has the capability, not only that has significantly enhanced resolution, but has significant display of color. By using slow flow, where you think there's capillary flow, to display really the significant color in that organ, to radiant flow that gives you an algorithm to really show you a 3D visualization of color Doppler with the margins well displayed. And overall, we have found that the system is substantially improved in the display of color Doppler. As you know, it has become more and more critical in the evaluation of the day-to-day ultrasound imaging. How about you, Rabia? What impressed you the most with color Doppler on the Voluson Expert 22?
The same like you, and especially now the combination of let's say of radiant on 2D and color Doppler, which gives you two, let's say, in 3D impressions. And getting with this high resolution, I can even scan earlier than 10 or 11 weeks and get with the Ultra HD, so high quality image in combination with radiant on the grayscale, give me also good, let's say, basic to start using color Doppler and sensitive slow flow HD where needed. And the same when advancing gestation, even if you have difficult scanning condition, I can still combine, let's say, in the new feature of augment, where I can see in difficult scanning patients in the deep, and combine this with color Doppler to visualize the heart, even in difficult patient to be scanned. So similar like you, but really enjoyable. I will not say better than the E10, but honestly it is. So let's move now, Alfred, to the next speaker. The next speaker is not less than Professor Larry Platt. Larry is a clinical professor on UCLA David Geffen School of Medicine and director of the Center for Fetal Medicine and Women's Ultrasound in Los Angeles. He will be discussing AI, artificial intelligence, and sonoliths on the system. Please, Larry.
Thank you very much, Robbie. It's really an honor to participate with such good friends and such great luminaries. I've been privileged and honored to be able to participate along with you and General Electric in their development of the Voluson Expert 22, and wish to thank all those at General Electric who really worked with me during this time. I have only a short period of time, so I can't mention everybody by name, and therefore I'll mention the group as a wonderful group to work with and really understanding our input and give the feedback and seeing the change that occurred after our feedback in the not only in the internal parts of the system, but the external parts of the system. And I'll refer to that a little bit later. I'm going to, in the brief few minutes that I have, talk about the important contributions that the Voluson Expert 22 is making to not only quality assurance, but its great advance in the AI, the artificial intelligence world, the buzzword of this decade. But it's not just a buzzword, it's a real thing, and it really makes a difference in what we are doing. So if you look at the applications of artificial intelligence, there have been many papers at the last ISWAG meeting, both the live one and the virtual ones. AI has taken over the application of improvement in our technique, improvement in equipment, improvement in quality, and more importantly, its user ability to improve your own performance, which is really important for all of us. So no matter what role you want to see for artificial intelligence, it has an application in clinical practice today, and this system is moving it forward by leaps and bounds to everything else that I've seen in this whole juncture of change. They say people don't mind change, they just mind changing. AI is helping us move that forward, that we all want to change because it's making things easier for all of us. If we think about what General Electric has done in the past decade, one of the first automation techniques was Sono-NT. While it's not directly AI, it automates stuff for us. And think about reassurance that that automation is appropriate. And AI comes in to help us, as you'll see going forward, some of the things that are in the system that will make a difference for all of us. It will improve techniques of the novice, and it will improve techniques for the experts. We will not want to have a system without it. So when we look at what's been done in some of the automation, you can see here's the Sono CNS. It's been around a while. Really, I think probably the first real entrance into AI for the Voluson systems. It's incredibly impressive and incredibly helpful. The motions that you make to get these measurements that can automate for us, the reduction of strain on our cells, and ergonomics plays an important role for us. It puts a lot of us out of work at times with shoulder, with hands, and what automation will do for us, especially when it's precise and efficient, makes a very big difference. So Sono CNS was one of the first really entrants to using AI, and it will reduce the keyboard strokes that we need, and that really makes a difference for sonographers and physicians alike. Enter Scan Assistant. Scan Assistant really is a flexible and customizable tool that assists users through each step of their scan more efficiently. It allows us to focus more important elements of the scan to increase our exam consistency and productivity while documenting quality assurance purposes. We need to think about quality assurance purposes, and actually in this upcoming Society of Maternal Fetal Medicine meeting, the President's program is about ultrasound quality assurance. Let me tell you, this is taking us there way before that time. Here's an example of Scan Assist where it will identify a head for us. It will then mark off that you have the markers, that things that you're supposed to have within the examination. Does it have the cavum septum pellucidum? Does it have the thalamus? What is in the image that you got, not just that it's a round structure. So Scan Assistant will now have a checklist for us to put us through that exam through a protocol that becomes essential for all that we're doing. There is something called SonoList. It's really an image recognition program that uses artificial intelligence, and it automatically detects the appropriate views that have been in the ISWA guidelines, which I think is pretty universally thought about. It goes along with AIOM and others as well, but it will identify the anatomy and will identify the appropriate places to measure the thing. It really makes us, again, reduce the strain, the time to acquire those images. Now, there are two types, but SonoList IR and SonoList S, but we should think about it the same. It really is going to help us meet acceptable standards at all levels, the expert and the novice as well. Here's an example of what SonoList can do for us. It will automatically, through artificial intelligence, recognize the structures that are on your image. It will show by a mark that you have obtained the appropriate image, that you can move on from your protocol. I think we will all become more and more protocol driven so that we can have the assurance, the quality assurance is there for an examination. What a wonderful tool for us to have as we think about pilots, how they use checklists for everything they do. Quality assurance is all about what they do. SonoList is in that same range of things for us. Here's an example of SonoList looking at the spine. You'll say, okay, it found the spine. It might check it off. The question is, what part of the spine? Is it the thoracic? Is it the lumbar? Is it the cervical? You need to get all of those in your measurements of the spine and recognition that you've gone through your protocol. This AI technology will allow it to be automated to identify and mark it off on the checklist that you have the appropriate image for that. Again, it will, if you need more assistance to what it's looking at, it'll actually draw that picture in a sense of what you have there. And here's an example of the video showing you that if going through the checklist, and on the right you can see the things that you've done already and recognize that that is why it is an important new tool for all of us. Something that is, I think, many ways futuristic, but that future is here now, is the ability to take a tool that you take a sweep through the chest, and with using AI, it'll allow the system to extract the views that you want to get, particularly, for example, the 4-chamber view, the 3-vessel tracheal view, that's so important that I'm sure you'll hear much more from Dr. Abu Hamid. And very clearly, this is really an amazing concept of coupling our input, the user input, and identifying potential heart malformations, which, as most users know, amongst the most difficult things for us to acquire and to be showing that we have good quality. Now, Sonolith isn't just for the novice. It's not just for your new sonographer that you have. It's for all of us. It will improve efficiency. It'll improve workflows. It'll make sure that we adhere to the protocols that we all should be on an anecdotal experience. There was a large group that began to look at lists and show that it reduced in their review of large numbers of patients, it reduced their errors in not conforming to the protocol of making all the measurements once they implemented it. At first, sonographers didn't want to do it, but after they did it, they realized how helpful it was for them. So it will improve protocol adherence. It will improve consistency, which you and I know is so vital. It's also great for educational, teaching fellows and teaching residents and teaching clinicians in practice. And it has a very important part of quality control, which, as I said, will be highlighted this year across the board. So if someone said you could improve ergonomics by reducing keystrokes, about 65% with this new design, decrease scan time, focus on patients and not the buttons that we do, keep track of anatomy for multiple complex exams, why wouldn't you? Embrace it. It's here for us, and it will make a very big difference. Again, I think this is a system of the future. The future is now. It's incredibly designed. More importantly, image quality is spectacular. The resolution is my go-to machine, and I can tell you that it really makes a difference in diagnostic ability. It makes a difference in user ability. And I had a patient just last week who I scanned her the first time on the system, and when she came the next time, I used one of my other E10s, and she looked at the image, which is a beautiful image, and she said, wait a minute, what about that other machine? I could see it much better. It was an amazing difference. This advance of Voluson Expert22 you will love. Again, I want to thank General Electric and their entire staff, research staff, clinical staff. And again, I won't mention names. I could mention them all. I'd love to, for giving me the opportunity to work with this wonderful system. Thank you very much.
Thank you for this presentation, Larry. So Alfred, tell me, what is your vision into the future of the role of AI in ultrasound in general and fetal medicine in particular?
Yeah, as you know, I have been in this space for a while, you know, really from the time we did some evaluation of the fetal heart using SonoVCAD and working collaboratively with the GE engineers. I truly believe that AI, as you know, and you see now from the explosion in research on AI in imaging, will play a critical role in ultrasound. And I'm really excited where the Voluson Expert22 had really taken a huge leap forward in AI, whether it is, you know, recognition of planes, you know, standardized planes, whether it is an automated measurements, but also, as you will see, in the ability to display planes out of a 2D clip of the fetal heart, which will play a significant role in enhancing screening for the fetal heart. So there is a lot of automation packed into the system, and I'm really excited about that. And I think automation will be part of ultrasound, will play a huge role in the future in that. How do you see, from your perspective, Rabia, how do you see the automation play out in the future? And what's your experience? Have you worked with the system for almost 18 months?
Yes, similar to you. So the first time I saw it, I said, okay, this is nothing I may use personally, because it's mainly the tools you were discussing, like the VHS and the Sonolus and so on, mainly for, let's say, the young examiners learning ultrasound on one hand, but soon or late, this will be, let's say, part of our everyday's work. And this is why I liked it very much, because it shows that the system has decided to go a step forward into the future. And this is only the beginning. I remember many years ago when the first time I saw the automatic measurements of, let's say, Doppler, I said, I don't need this because I'm quicker today. I cannot imagine working without that. The same for other measurements like Sono and so on and so on. So it is now more and more full and packed with new features. I'm really looking forward to seeing what's come next in our field. And I hope, let's say, what people are afraid about AI, that will be replaced by the machine. This is not the case. It will facilitate our work, like all computers are really facilitating our work. And there will be a new way of thinking. And this is the signature the system, the Expert22, is giving.
The next speaker is Professor Gregory DeVore, Director of the Fetal Diagnostics Center, Clinical Professor at UCLA David Geffen School of Medicine, and Adjunct Professor at Wayne State University. Greg will expand on the evaluation of the fetal heart on the Voluson Expert22. Greg?
Hello, Robbie and Alfred. It's a pleasure to participate with you on today's program. The title of my presentation is Expert22, Things I Like When Imaging the Fetal Heart. Let's first begin with slow flow when imaging the fetal heart in the first trimester. This is a first trimester fetus at 12 weeks and 4 days. The nuchal translucency was 4 millimeters, suggestive of a chromosomal abnormality and/or congenital heart defect. The image on the right was obtained using the endovaginal probe, RIC 5-9, to obtain these images. The two-dimensional image suggests an endocardial cushion defect. When the slow flow was activated, the atrioventricular septal defect was identified as a confluence of color. Note how the ventricular septum is clearly identified, as well as the disproportion between the left and right ventricles. This was an AV canal defect in a fetus with trisomy 21. The benefit of slow flow is that it clearly identified the blood pool of the right and left ventricles and the ventricular septum. Another new feature found in the Expert22 is two-dimensional radiant imaging, which has 3 settings: min, mid, and max. Radiant imaging highlights highly reflective structures such as the endocardium. Notice the gradual increase in clarity of the boundary between the blood pool and the endocardial borders as one transitions from no radiant to max radiant. This compares mid versus max radiant. Note the increased clarity of the endocardium and the muscular band within the interventricular septum. Let's now examine the min setting in a 20-week fetus. Compare the regular fetal heart settings on the left with the radiant min setting on the right. Note the clarity of the endocardial borders when radiant min is activated. In the next few slides, I have combined radiant min with color Doppler and decreased the color balance to 25. The image on the left demonstrates the color Doppler bleeding over the interventricular and interatrial septa and ventricular walls. When the balance is reduced to 25, there is no bleeding of color over the septum, and a perfect match occurs between the blood pool and the grayscale cardiac anatomical structures. This illustrates the transition from the 4-chamber view to the left outflow tract. The image on the left is the grayscale radiant min setting. The middle image demonstrates the addition of color Doppler with the default settings. On the right, the balance setting was adjusted to 25. Again, note the accurate matching of color with a grayscale image, with no bleeding over the septum and clear identification of the left ventricular outflow tract. This is the 3-vessel tracheal view with radiant min setting, the balance set at 25. Again, note the clear separation between the blood pool and the anatomical structures. This illustrates the addition of slow flow HD to identify the pulmonary vessels and the corresponding pulse Doppler of the pulmonary vein and artery commonly used to evaluate fetal arrhythmias. Let's now examine radiant max setting. This is my favorite setting when examining the fetal heart with two-dimensional ultrasound. Notice the separation between the ribs and the skin. In addition, the endocardial borders of the heart are clearly identified. The enhanced endocardial borders of the ventricles improve their identification when performing the fetal HQ examination. Note the same observation of improved wall clarity for the 3-vessel tracheal view. Here's a transverse sweep suggested by all screening protocols of the fetal heart, demonstrating the 4-chamber, 5-chamber, 3-vessel, and 3-vessel tracheal views. Again, note the clarity of the cardiac structures. Let's now examine a 31-week fetal heart with a radiant max setting. Note the clarity of the cardiac structures and the short axis of the ventricles on the left and the 4-chamber view on the right. Again, note the clarity of the aortic arch. Just a brief comment regarding fetal HQ. While these are familiar images depicting the 24-segment transverse ventricular size, shape, and contractility, additional measurements with their z-scores and centiles are now available. The right and left ventricle size measurements with their z-scores and centiles are now displayed on the screen. In addition, the z-scores and centiles are displayed for the left ventricular function and right ventricular function. This now provides a complete analysis of ventricular function for the fetal heart. This represents a sample of the printed report. In conclusion, Expert22 provides some wonderful new tools that will enhance the imaging of the fetal heart. Thank you.
Thank you, Greg, for such a valuable presentation. Robbie, I know that you've been in the space of fetal echocardiography for a long time, and we collaborated on 3, I'd like to say, exceptional books on fetal echocardiography over the years. Tell me, I know you spend a lot of time on the Voluson Expert22 on the fetal heart. Tell me what your experience is and how did this compare to what you've seen on the E10?
So yeah, there's a question which is will be often asked at the end of the day. What is the difference between the E10 and the Expert22? I tell you, say this is a major step forward with by adding, as Greg has shown, radiant on the grayscale, because it gives you the image clear. At the beginning, it looks a little bit difficult to see and to accept, but you should start by the minimal level and then augment to the maximum level of radiant, and then later on you will enjoy, because you see clearly the black is black and the borders are well defined, and you can really appreciate the quality of the image, especially that you can combine this very nicely with the color Doppler and with the sensitive color Doppler. So this is why I enjoyed very much working with this. And to be honest, at the beginning, I said, okay, there is only this difference. But I'm sure, like me, when you return to work back on the E10, you say, oh my God, no, I want to come back to the Expert22, because the contrast is nice, the image is so clear. And by using in good scanning patients, the alpha HT, you can go to a level higher of quality and resolution. So, but Alfred, you were challenging me. Don't tell me we have to write now the 5th edition. We just finished after 3 years of 4th edition. Sorry.
No, we're good.
Okay,
we're good as is. We just had the book out. Okay. But yeah, my experience is the same. I initially, when I first saw the Radiant 2D, I was taken back a little bit, but then I got used to it, and I didn't want to scan without it. So it is very helpful for the fetal heart. It highlights the borders really well, as you mentioned. Also, it's helpful to look at, the pulmonary veins is exceptional to see the pulmonary veins all the way from the lungs all the way into the heart. Yeah. And especially when you have complex conotruncal anomalies and complex aortic arch abnormalities, I think the combination of radiant 2D plus radiant flow, and sometimes slow flow when needed, is really significantly helpful in these complex diagnoses.
So Alfred, do you like the images of the Expert22?
I do too. I mean, as I mentioned at the beginning of this presentation, I was most impressed with the quality of the 2D with and without radiant. So I think it is at some point in the past, we thought, well, maybe ultrasound had reached its peak, ultrasound physics, you could do so much with ultrasound physics. And every new release, I'm so pleasantly surprised how much ultrasound technology there is to be discovered. And it's really impressive where we are today compared to where we were in our lifetime, 20 to 30 years ago, where the images were. So it's really impressive work and amazing where the technology is heading.
So if you like images, let's move now to our last presenter, which is the master of images and who needs no introduction. It's Dr. Bernard Benoit from Hospital Princess Grace in Monaco, who will show us how to achieve the unachievable and what he was able to produce out of the machine with his exceptional skills. So please, Bernard.
Good afternoon, ladies and gentlemen. What I will do this afternoon is to talk about my experience with the Voluson Expert22. And I start to use this system around 18 months ago. So I have already some experience with it. There are two new features that I really appreciate also on the V22. We have many new things on it, but what I really appreciate, it's a B mode with a radiant, and also there are new settings for the silhouette mode with HD Live Studio. What is radiant? Radiant, you know it because it's a post-processing filter. It's used since 5 years with color Doppler, and with color Doppler, it gives you 3D appearance. It's a post-processing, and this is a standard one, and this is when you apply the radiant. So it's nice, but it's really important when you are mixing with a slow flow, because when you do a slow flow, you can see all the teeny vessel, but when you do it, it's not the correct diameter of the vessel, it's larger, and if you apply the radiant, you will obtain this picture. So it's really more accurate, and you can see more all the small vessel here. And now it's work also with the 2D, that means with B mode. How to find it when you start to use it? If you go to routine resolution, here you have a submenu. Here it's a radiant, and you can choose different values. You can go to minimum, mid, and maximum. And what I use, always I use mid or maximum. And I use it also with Ultra HD. And you will see now some difference between what we can do. And this is a picture, it's made without, this is a standard one, and this is exactly the same data, but with the post-processing radiant. And look at this part, here. So it looks thinner. That means you will have more detail and with more accuracy. So the benefit is to increase the sharpness. Again, here you can see the difference, and especially here with the thickness of the bone. And here, this is a liquid part, the pericerebral liquid here. And you can see here, it's less. So this is with radiant, and this is a posterior fossa. And also in this case, you can see the space here looks larger here with a radiant. So the benefit is the increase of sharpness. So this is okay. There is one disadvantage. You have increased contrast. And I know that some doctors, when they saw the picture, tell me some are really, wow, it's fantastic. And other doctors told me that the contrast is too high. They do not like it. So, but you have to learn to use this method. And this is the same picture, but with a radiant and with the standard one. And you can see here the nasal septum, and you can see all the detail. It's thinner than here. But the best result is obtained with some probe, especially with the RIC 6-12, the RM7C, EM6C, and C229. This we have a really good result. And this was obtained, during the first trimester of the pregnancy at 12 weeks, 13 weeks, and it was made with a C229. And this is first trimester of the pregnancy, the kidney, liver, and the lung, and it was made with RIC 6-12. Here, with the C229 hydronephrosis, you can clearly see the kidney and the bladder here. And this was late in the pregnancy. It was made with RM7C with liver, intestine, and this is a gallbladder with sludge inside. And this, in the first trimester of the pregnancy, it was obtained with a C229, and you have a cyst inside the umbilical cord and with a duct here going to the bladder. It was a urachus cyst. The mid-sagittal plane of the brain with the corpus callosum and the pericallosal scissure. A cyst in the choroid plexus, and also in the first trimester of the pregnancy on early stage, an embryo, and this is a brain cavity of embryo at 9 weeks of pregnancy. Now with some video, this is a section, axial section of the tummy, the abdomen, with we saw one kidney, we saw the spleen here, and what the spleen, what you can see here, this is intestinal peristaltism, and this is the stomach. And here it was late in the pregnancy also, where you can see the colon, and the colon is not seen before, it's always seen on the last examination, that means around 32 weeks of pregnancy. And this is the bladder emptying. During the urination, you will see the decrease of the size of the bladder. And this is the placenta with calcification inside. A cleft-lipped palate at 26 weeks of pregnancy. An embryo with the umbilical cord cyst and the brain of a 9-week embryo. Now, I will speak about the silhouette mode. And it's possible now to edit the setting of the silhouette mode, and you can really see many things inside the volume. And I will show you how to obtain it. And this is nice because you can see the external part of the fetus, but also what is inside. And especially now also it's possible to see the bone, the skeleton. And you remember what was the silhouette? It was launched in 2014. And at the beginning, it was a method to see the interface between liquid and solid. That means it was possible to see the liquid part inside the fetus, inside the embryo. And this is a quintuplet with 5 gestational sacs. Here at 9 weeks of pregnancy with brain cavities. And this is gallbladder and the umbilical vein and the stomach, and this was a kidney with hydronephrosis, and this is liver with umbilical vein, the portal vein, the gallbladder, and this was a cyst of the liver. And I show you now some examples. This is how to do it. It was a 12 weeks scan. And this is what I like, because you don't have to use a magic cut, not yet. Just move inside, and you have to change also the value of the gain. But here it was possible to see the ribs, intestine. And this is another, it's not the same, it's another fetus at 12 weeks of pregnancy with different settings, where also you can see the ribs inside, you can see here the femur, the umbilical cord, and inside the brain here the 2 ventricle and the 2 choroid plexus. And it depends on what setting you are using. You can use a setting to highlight only the soft tissues, that means here the intestine. This, the liquid part, this was an umbilical cord with a single artery. And also you can have a mixed, so you can see inside the bones, the bony structure. And I really like it because you can see the envelope of the fetus, that means completely the fetus, and inside the bone. And there are many clinical applications, but I will show you this one. It's always difficult to give the position of one ear if you are using the 2D ultrasound. But with this method, with the silhouette, and also you can see the bone inside, you can clearly see where is the ear, And also you have different landmarks. You have the sphenoid fontanelle, the squamosal suture, and the mastoid fontanelle. So you can give exactly the position of the ear, and you can tell if it's a normal position or abnormal position. And here, other case of malformation. Here it was a hydrocephalus with a cystic hygroma from a profile view, and this is you can see the two eyes, and this was a dilatation of the two lateral ventricule with here the two choroid plexus. And you can compare, this is a normal one, and this is when you move inside, you can see the orbit, you can see the lenses, the ventricle, the choroid plexus inside, and also different part of the bones. And this is a normal one at 22 weeks with thorax, diaphragm, the heart, and also on the heart you can see the great arteries and what is inside the abdomen. And this at 17 weeks was a normal one, but we use another setting, and you can see the intestine, the liver, stomach, the lungs, diaphragm, and the bones. And this was a case at 13 weeks of pregnancy with ascites and with liver, and this part with liquid inside the abdomen. And now what I like to use, it's to use a grayscale, because I like grayscale, and I start to use it now more and more. We can see more detail. I prefer to the skin mode, and this is a 2 kidney with hydronephrosis, and this one was a baby with a pleural fetus with pleural effusion at 13 weeks of pregnancy. You can see here the pleural effusion and the heart, and this is a view from the top, and we scroll from the top to the lower part, and you will see it looks like a MRI with the lungs, the pleural effusion, and this was embryo at 10 weeks of pregnancy with a large nuchal translucency, and here this is a nuchal translucency. You can see the two hemisphere here with the ventricle and inside the two choroid plexus. So this is really what I like with this silhouette mode, and this is my dream, is to have to do a real ultrasound, volumic ultrasound. That means you have the volume of the embryo or the fetus, and you can see with transparency everything inside. You just have to change some parameter to see the different part, but this is nice because only with one view you can see everything, the shape of the fetus and also what is inside. So this is the end of my lecture. I hope I had given you the desire to discover and to use this new system and with this new function. And you have also more of other function, but really, really try the system and use it. Thank you for your attention.
Thank you, Bernard, for this incredible presentation. As always, you are the master, and what you could do, nobody can do. So it's incredible to have your feedback on the system, and I know how impactful you have been to the development of the system. So Robbie, tell me what you see. You saw Bernard's presentation, you saw the quality of the images, you saw how he played with silhouette to really create an MRI display of ultrasound images through volumes. Tell me what your experience has been, you know, kind of using 3D on the system, but also in general from the 2D and color images.
So yeah, you know, it was always the same every year when we have a new breakthrough with the Voluson system. I went to a meeting and new or assume they have done the maximum out of the machine. And when I see Bernard presenting things, I say, oh my God, I have to return back and work on it. So after his talk, I'm now really challenged to try to do the same, but he's always giving us his secret. So there is nothing secret in what he's doing. You can do it on the system. So even the engineers are surprised what he can produce out of the system. But, you know, it shows me also, let's say, the capability, what we're seeing at the beginning of this new equipment. And this is why I'm really, let's say, positive, enthusiastic that the customer later on will be also happy in using this system. So at this stage, also not only thanks to Bernard, but also to the engineers who are working hard in the last 2-3 years on developing this excellent new product.
Yeah, it's really impressive. So as we get to the end of the presentation, Rabia, tell me your overall impression of the system.
So, you know, Alfred, in addition to what you have heard already, the amazing thing in the new system is that the machine for a wide group of people. We have heard today different approaches, but let's say if we take the group of the beginners, the one who are scanning at the beginning, in general, they will not on a normal condition scan on a high-end machine, but for them, the system is quite nice because if you have a big unit, when you have people learning ultrasound, you can do it. So you have a simplified way and support in your work. We have seen the role of AI in this concern. The majority of the user, however, they will find the system an optimized machine where you rapidly get to an excellent image with shortening the examination time. We spoke about the ergonomy of the system. We spoke about the augment and other features where you can scan difficult patients in a short period of time and having also the facilities of the flow profile. And for the experts like the speakers today, you have the high-end possibility of getting with the use of the, for example, Ultra HD function to the best image resolution and with the slow flow HD to the most sensitive color on an ultrasound system, in addition to many new tools on 3D, as we heard by Dr. Benoit, that you can manipulate directly on the touch panel. So in other words, the expert gets directly to the desired image for an optimal diagnosis. So this was my general impression, Alfred.
That's a great summary, really, that shows the usability of the system to various people, and even the most expert can really still improve their ability to image and their ability to diagnose with the system. So in this short time, we were able to give you our first impressions of this amazing system, but there's so much more to see and experience. To summarize, we will pass you back to Barbara, who will show you the product video on the Voluson Expert 22. Barbara?
Thank you, Professor Abu-Hamid. I'd like to take this time to thank all of our presenters and, of course, our wonderful host. So let's take a moment to see how all of this comes together. I present the Thank you for taking time to participate in our webinar today. This is just the beginning of the journey for the Voluson Expert 22. If you'd like to learn more about the product, please visit our website or contact your local sales representative. We will also be featuring the Voluson Expert22 in many of our upcoming trade shows and congresses. We look forward to seeing you in the future and hearing your feedback on this innovative new system.